And for more on Trump's pharma tariffs, I spoke with Dr. Jay Wolfson. Dr. Wolfson is a distinguished service professor of public health, medicine, and pharmacy. He's also the senior associate dean at the Morsani College of Medicine at the University of South Florida.
Has been taking advantage of market circumstances and has been producing offshore for 30, 40 years and causing the price of pharmaceuticals in this country to be sometimes 3, 5, and sometimes even 10 times more than it is in most other nations in this world.
Wow.
And there's been talk about finding ways to encourage the pharmaceutical industry to either cut their costs where they're manufacturing them, when they're selling them here, or to bring the manufacturing back to the United States. So what President Trump is doing, he talked about this during his first administration, is telling the pharmaceutical industries that they're either going to have to work to cut deals to reduce the cost of pharmaceuticals to those who are most in need, and generics are a big part of that. Seniors are a huge part of that. And to bring manufacturing back to the States and make good faith demonstrations. They're doing that in order not to be affected by these tariffs. This is a deal arrangement, which he's been very successful in doing.
Okay, so and as you mentioned, Trump has long promised to bring drug prices down, and he is hitting up nations with significant pharmaceutical tariffs. To what degree do you think these tariffs are figuring into all of this that unfolded today?
Well, I think it's significant. I think the manufacturers and the exporters would have to pay extraordinary amounts of money to bring them in, and they'd have difficulty distributing them at the higher prices because insurance companies may not pay them. So this is really forcing, I think, the pharmaceutical industry and the manufacturers to either cut a deal to reduce the prices that they sell their goods for in the States, or what I think we've really been talking about for a long time is bring the manufacturing of pharmaceuticals back to the United States.
And now the administration has been talking with drug companies, and Trump wanted these companies to lower prices voluntarily, more in line with what people pay internationally, as we've been talking about. How has the industry responded so far to this?
They've said they would like to do something about that, but they really haven't taken any steps toward it because there was never any financial incentive that forced them to do it. The tariffs are really pushing them to do it, along with the public outcry that has gotten very loud. Healthcare costs and access to essential services in the United States has been a real challenge for years. Mr. Trump is changing some of the terms of the Affordable Care Act, which are going to reduce the government subsidies for certain things, making it more expensive for some people to access healthcare, just as it was before the Affordable Care Act. So we're kind of going back to the way the healthcare system used to operate before the government heavily subsidized individuals and parts of the country. I think the tariffs are acting as the deal-making force that the pharmaceutical industry needs, and they know that the president is serious about this. He's not gaining around the way other people have talked about taking care of the cost of drugs.
You know, it's all very complicated too, the way the pricing of pharmaceuticals works, and a lot of Democrats are very concerned that it sounds great on paper, but it's not going to play out the way Trump is spelling it out. So what degree do you expect to push back from other companies? Because look, research and development is costly and it's time consuming, and drug companies bank on recouping a lot of their money in medicines that don't pan out and by charging the consumers or the insurance companies more.
This has been a long-standing discussion, and you're right. Research and development for pharmaceuticals cost extraordinary amounts of money, and so many of the efforts to develop new pharmaceuticals turn out to be non-useful. But there has to be a rational balance, and the pharmaceutical companies in the United States have taken advantage of the circumstance beyond what is appropriate for a reasonable economic balance. They've taken advantage of not being overly regulated, their prices have not been regulated, and they've been able to do pretty much what they've wanted to do. And I think the experience that we had with the pharmaceutical companies during the pandemic and the concerns that were raised by a number of major national studies about the costs and the appropriate types of testing that were done have shined a very strong light on the credibility of the pharmaceutical companies making a good faith effort to make pharmaceuticals available to people in this country who need them at a reasonable cost, still making a profit and still developing new research, but not making the kinds of profits that they were making in the past.
You know, I guess the question is, when will consumers notice this, feel the benefit, if indeed it plays out the way President Trump wants it to?
Well, I think the most important thing is that consumers don't wind up paying more in the short term. If things go well, then generic drugs and essential drugs like drugs for diabetes and hypertension over the next couple of 3 years, if this works, should mitigate. The cost should mitigate and go down to make them more accessible and more affordable. We'll see that. The proof is going to be in the pudding there.